The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. We're about to start our webinar. So we are going to be presenting today the surprising results of LunchBags Efficacy Trial. So this will tell you a little bit about a research project that we've been working on for about 8 or 9 years, even more than that, and several of the results that have come about because of our NIH-funded R01 trial. So I am Deanna Helsher. I'm at the UT Health School of Public Health in Austin and director of the Michael and Susan Dell Center for Healthy Living, and I will be moderating today's webinar. So the presenter today is Dr. Cindy Roberts-Gray, who is one of the principal investigators of LunchBag, together with me and Dr. Margaret Briley at the University of Texas from the University of Texas at Austin. Dr. Roberts-Gray is principal of Third Coast Research and Development. She's an evaluation specialist, and she provides our psychology and child development expertise in this study. So we're really pleased to have her here to present today. So before we get started, just a few housekeeping points to bring out. So first of all, if you have any questions, please enter them in, and we will be able to answer those questions at the end of the presentation. So we're going to save all questions until the end. Secondly, today's webinar will be recorded, and we will have it on the Dell Center webpage, so you can come back and refer to it later. So we can send that out, the link to that, to everyone who's on the webinar. So sit back and enjoy the presentation, and Dr. Roberts-Gray, I'll hand it over to you.
Thank you, Deanna, and greetings to everyone from sunny Galveston Island. And thank you for being interested in early childhood dietary patterns and the surprising results of LunchBag's efficacy trial. Next slide, please. So LunchBag is an intervention targeted to early care and education settings where parents are required to send lunches for their children to eat at the Early Care and Education Center. And the way I'm going to structure today's discussion is to talk about, well, who needs it, and how do we know if it can be useful, and what lessons were learned to assist next steps. Next slide, please. Most preschool children in the United States, like most adults in the United States, eat much less than recommended amounts of vegetables and whole grains. And this chart is from the research comparing the food survey research groups comparing 2003-2004 in Haines with the 2013-2014 in Haines. And it shows that vegetables, if anything, are getting eaten less than they were before. And whole grains are much less, and refined grains are much more, and also children are eating surfeits of calories from foods with added sugars and solid fats. Next slide, please. And when we try to think about how we might reach children and their families so that we can increase vegetables and decrease reliance on foods that are high in added sugars and salts and fat, we find that about a third of all 3 to 4 year old children in the United States regularly participate in an organized early care and education facility. So reaching those kids in that way and their families is a good platform, and that's why Lunches in the Bag is targeted to those early care and education facilities. Next slide, please. Survey research that other people did in 4 Western states indicated that about 40% of early care and education centers in the United States have some or all of the food for the children sent from home. When we did some local surveys in Texas, in San Antonio, only about 10% of the sample that we contacted required food brought from home. But in Houston, it was 20%. So there are a substantial number of facilities that do rely on parents to send food from home. Next slide, please. Sending lunch from home is a good opportunity for parents to help their children come to expect and to enjoy meals with healthy patterns, because as you're packing the lunch for your preschool child, it gives you the opportunity to talk to them. If you pack a healthy lunch every day, it gives repeated exposures to the child of a healthy lunch pattern. And it also communicates to the child what you as the parent think is the right thing to eat in the middle of a happy day. The next slide, please. So, what's for lunch? Our studies have included going to the early care and education centers and looking at what's packed in the lunches, and also observing what the children eat from those meals. So next slide, please. And what we find is a pattern that's very like the way that people are shown to be eating foods in the United States. Lots of foods with added sugars and fat and salt, but only a very small amount of vegetables, less than the recommended amounts for whole grains and dairy. And then the children's eating pattern, if you see what all the children are eating, they are eating some of almost everything that's in their lunches. But again, the pattern is, you see that there's not very much vegetable eating going on. Next slide, please. So who needs intervention to increase vegetables and whole grains in preschoolers' packed lunches? And we think there are these 3 groups. Any parent with a child that's at some point, a preschool child, is highly likely at some point in time to be packing a lunch for their child to eat somewhere else. And every ECE, for early care and education facility that provides care for preschool age children, will have field trips or situations where they want to have food brought from home. But we are, especially for our research, we're looking at the facilities that rely on children to bring back lunch. And if we sort of hit a middle of the road and say, well, let's assume that we don't have 40%, but we don't have fewer than 10%. So if we go with 20%, that's talking about 26,000 facilities in the United States serving approximately 1.3 million families. So that's a large segment of the population in the United States. Next slide, please. In developing our intervention, there were 6 categories of factors that the research literature suggested as mediators of parents packing little or no vegetables but large amounts of sweets. And I've listed them here. Conflicts in your expectation about what the children want versus packing a healthy lunch, your lack of knowledge or self-efficacy or intentions, lack of availability of the healthy foods in the home environment, small amounts of social and policy support from your ECE center, conflicts, child fussiness, or parents' feeding practices rather than cooperation in the parent-child interactions. And then the one we're going to be talking about today from this particular study is children's greater acceptance and intake of sweets and preference to vegetables and healthy foods. So when you take those factors, next slide please, and then use theory, and the intervention is grounded in social cognitive theory and reasoned action and an environmental approach, an ecological approach. So you take those 6 triangles and put them on the table to try to say, well, what kind of intervention do we need if we want to get to more vegetables? And this is the intervention logic model. And I'm showing you this very complicated figure now because we're going to come back to it in a little while. Next slide, please. So the intervention is designed for 5 weeks of focus on nutrition in the fall of the school year with a 1-week booster in the spring. And I've color-coded the different major components to fold back on the logic model, because at the individual level of trying to reach the parents, there's newsletters and notes that are sent from the ECE Center to the child's home to reinforce and to prompt healthy lunches. And then at the interpersonal level, there are learning stations installed at the Early Care and Education Center to encourage conversation between the children and the parents about healthy lunches, and also to give opportunities for parents to communicate with other parents about healthy lunches. Then there are classroom lesson plans and resources for activities to encourage children to accept and eat vegetables and other healthy foods. And finally, there's at the organizational level of the Early Care and Education Center, there's the calendar that says focus at least this chunk of 5 weeks in the fall and another week in the spring on nutrition. And then all the resource materials and also some training to support the ECE Center's role in nutrition education and advocacy. Next slide, please. So here are some photos of the kinds of materials that the ECE Centers get. And if you look just at the way that it was designed and say how much engaged time would that result in, is that the parents would be about 9 hours, the children about 17 hours, and the ECE staff about 23 hours of engaged time with the various components of the intervention. Next slide, please. So our efficacy trial for that intervention was powered to detect change of more than half a serving of vegetables. And it was a cluster randomized research design, so that we recruited 30 early care and education centers, all of them in Central Texas area, Central and South Texas, with 15 randomly assigned to the intervention and 15 to a wait list control condition. And then we recruited families at those facilities, and we were successful in getting 633 to enroll in the study. That was about 42% of the parent-child dyads that in those centers. So that was, we got a good sample from the early care and education centers volunteering to be part of the trial. Then the ECE staff were also invited to participate in the study, and we had 177, mostly center directors and the lead teacher in classrooms that included children ages 3 to 5. The primary outcome measure was the number of servings of the target foods packed in the parent's lunch, but a secondary outcome measure was the children's frequency of eating the target foods, and that's the one we're talking about today. And so then we had 4 data collection times, baseline before the intervention at intervention centers, and then a 6-week follow-up, which would be right after the 5-week intervention. And then just before the booster week in the spring, we did a follow-up. That would be the 22-week follow-up. And then the 5 weeks later after that would be the 28-week follow-up. Next slide, please. And the intervention effected positive changes in all of those triangles. So we were very pleased to have some effect on all of the things that we thought we might need to affect in order to get more vegetables and whole grains in the lunches. And we also did get the increase in number of servings. And now I'm going to, next slide, show you where that worked. So we didn't get the positive effects on every one of the food groups at every one of the intervening variables, but we did get the kind of changes that made us comfortable that it was the intervention that our intervention logic was a good logic to have in trying to change parents' packing of vegetables and whole grains. And now I want to talk about, and all of these things are there's like the parent knowledge and the early care and education procedures for nutrition education, the other psychosocial variables. These are things that are published in a variety of different places or presented at conferences. Next slide, please. So what we are doing with the rest of this now is the second part of now that we've seen that how we know that it's effective, our next part of this presentation is to talk about, so what did we learn about next steps? So our hypothesis about the effects on children's food intake, and that's what I'm focused on in this particular presentation, was that the children in the intervention condition would more frequently be eating vegetables, fruit, and whole grain at the 6 and 28-week follow-up periods at lunchtime. We also measured children's preferences. We were hoping to see changes in children's preferences, and we measured children's preferences by evaluating the proportion consumed of the available food in each of the coded food groups. That is the eat to pack ratio. Next slide, please. So the first thing we can look at then is we did get the positive effects on children consuming some amount. We didn't look at it. This isn't about how much, this particular slide isn't about how much they consume, just did they eat at lunchtime vegetables, fruit, whole grain, refined grain. And you see that at the 6-week and the 22-week and the 28-week, we got increases in the children's eating vegetables at the intervention center. We had only one time when we got a significant interaction effect for the whole grains, and that was at the 22-week follow-up. And at that same point in time, there was a reduction in the frequency of children's eating refined grains. So it suggested the possibility that what parents were doing was substituting whole grain products for the refined grains, although this is a picture of what the kids are eating. So I want to keep that in mind. Next slide, please. Then we also looked at the chips and the sweets, chips, potato chips, cheese crackers, those salty snack foods, and sweets were sweetened sugary beverages and cookies and other confections. And in this case, what we saw was, it's sort of hard to interpret this. We did get the positive effect, but what it looks like that positive effect was for sweets was that it was preventing the increase. If you look at the control condition, you'll see that they kept getting more and more sweets in the lunch, eating more and more sweets as time went by, the year went by, whereas in the intervention condition, it stayed down down toward the 55% range. So it is relative to the control condition, it is a significant decrease in the percentage of children eating sweets, but it looks more like prevention than it looks like actual reduction. So next slide, please. So in order to understand what does that mean, what are we seeing here, we have to look at it in the context of what the parents were packing. And so this is a baseline chart for the percentage of children eating any amount of the foods compared to the percentage of parents who pack any amount of the foods. Now, at each observation point, we had 2 observations. So there were two randomly selected non-weekend days, or I should say weekdays. So this is not only averaged across the children, but also across 2 days at each intervention each observation point. So here at baseline, if this was the kind of perfect figure that we would like to see, everything would be for fruit and for vegetable and for whole grain and for meat, bean, eggs, nuts, and for dairy. We'd have hundreds, that 100% of the children every day were seeing in their lunch fruit and vegetable and whole grain, and 100% of the children were eating those things, and there would be less fruit. So it's like we would sort of expect a semicircle would be the best kind of thing for ideal. So then let's look, so then, next slide please. We're going to slide that one up to small and compare it to what we saw at the 6-week follow-up. And we see that we got that increase in parent packing fruit. We got increase in parents packing vegetable and increase in children eating vegetable, increase in parent packing whole grain. Next slide, please. And then 22 weeks later, this is all just for the intervention group, by the way. This is just the intervention group. 22 weeks later, this is after so we've had a lapse with no intervention now between that first 5 weeks. We're now just about to do the booster, and we go back and look again. We see that there is still, parents are still packing. We have more parents packing fruit. We have more children eating vegetable. We have more parents packing whole grain and more children eating whole grain. We have fewer parents packing and fewer children eating whole grain. And we have fewer, relative to the control group, fewer parents packing sweets and fewer children eating sweet. Next slide, please. And so then after the 1-week booster, we've still got the good outcomes for vegetable. And for parents are still packing more whole grain, and children are eating less sweets. And then we've got one blot on our record, is that at this 28-week follow-up, compared to baseline and compared to the control group, parents were packing more of the salty snack foods, and children were eating more of the health. There were more children eating salty snack foods than in the control condition. So that's why there's a little blot out there. That was the single blot on our record here. Next slide, please. So the surprise number one then, in looking at those charts, is that when the parent packed it, the children ate some of it. That was surprising to us. Next slide, please. But the bigger surprise was that there were no changes in the children's lunch eating without a preceding change in the parental lunch packing. So even though the dose of intervention, the way the intervention was designed, was more for the children than for the parents, the changes in the children's behavior were always preceded by a change in the parental lunch packing behavior. Next slide. And that observation that every change in the children's eating every significant change in the children's eating was preceded by a significant change in the parents' packing of that particular food, held also for numbers of servings consumed by the children. So this is that first chart that I showed you, but broken out by packing and eating for the intervention and the control groups by time here. And in all cases, if you say, look, there the children increased the amount of vegetables that they were eating, there had already been an increase in the amount of vegetables that parents were packing. Next slide. There was no evidence of change in the children's food preferences. For each food group, the eat-to-pack ratios were stable across our multiple observations and across treatment. And the other thing that's notable in looking at these data is that it says that the children are eating that on average, across times, across those multiple observations and across children, on average, the proportion of food that the children are consuming is about 60% of what's available to them in their lunch. Next slide. So that was surprise number 3, that children consumed approximately half to 2/3 of whatever amount of whatever foods the parents packed. Next slide, please. So then how did that help? What was learned to assist next steps? The first thing is that we feel like the data show us that wider dissemination and implementation of LunchBag is both needed and appropriate. But that we also need some improvements to increase vegetables and minimize sweets. That we did get significant effects, but even after the positive effects of the interventions, parents packed and children consumed less than recommended amounts of vegetables and fluid milk, but surfeits of refined grains and sweets. Next slide. So an implication is that it's important for parents to know that preschoolers will eat some and leave some of whatever food is served. And then it also suggests the possibility that children's eating is regulated by perceptual cues of food availability rather than our traditional notions of food preference. Next slide. Understanding why young children leave as much as 1/3 to 1/2 of every kind of food that is available in the lunch bag is an important topic for future research. And this situation has been noted in other kinds of research, like the studies of the National School Lunch Program and the Child and Adult Care Food Program. And the results from those studies show that preschool children eat about 60% of whatever food is served, or 60% of whatever food they serve themselves. Next slide. So the next implication is that understanding why parents pack their preschoolers' lunches with large amounts of sweets and small amounts of vegetables remains an important topic for future research, because we've seen that the children are that if you pack the lunch with a whole lot of sweets, the children are going to eat about 60% of it. If you pack less sweets, they still eat about 60% of it. If you pack very little vegetables, then they eat very little vegetables. If you pack more vegetables, they eat about 60% of it. So that's an important thing to try to understand. Why is it that parents continue to pack the lunches with so much sweets and so little vegetables? We need better understanding of that. Next slide. Oh, I'm ready for questions and comments.
Great. Thank you, Dr. Roberts-Gray. So we have several questions. So one is, you mentioned investigating why children leave food. I have wondered if time provided for lunch is a factor. In elementary school, I do believe this is a factor, but I'm not as sure about pre-K. Would you like to go ahead and take a stab at that, Cindy?
Well, yes, is that if you look at the National School Lunch Program and the Child and Adult Care Food Program research, there is a developmental trend apparent in those data, so that the youngest group of children leave about 40% of their food. The elementary school children leave slightly less than that. But when you get to middle and high school age children, they're eating 70 to 80% of their food, and adults are eating 90% of the food that's available to them. This is a developmental phenomenon. And so I don't think it's just, I mean, certainly time will have an effect, but you know, how rushed the children feel to eat. And I have observed in early care and education settings that one of the most frequent things that teachers say is hurry up. So eat your food and then we can go outside or whatever. So time is a pressure, but what was so striking in our results with the packed lunches is that we got the same proportions of food being left as are reported in multiple places for investigations of large meal programs. And I think we need to look at this as a developmental phenomenon, and the kinds of things that we speculated about in the paper on this surprising results paper was that it could be the age of the children, that young children cognitively are at a stage where they judge things by the way they look. They're overwhelmed by the visual and the tactile perceptual characteristics of things, as opposed to paying attention to their internal satiety cues. That's a difficult thing to do at preschool age. Another possibility is that we are teaching children to leave food, is that when they are toddlers and just acquiring their language, they keep making gestures, we keep putting food on their plate until they're not eating it anymore, and then we know that we're all done. So it could be that we're teaching them to leave food. And yet another possibility is that it is truly a developmental, you know, it's part of the human nature of learning about how to eat and the social nature of food too, that it's built into us to maybe save food to share with others. So there are lots of possibilities and we haven't researched them, and they need to be researched.
Thank you, Cindy. So we do have a question here that asks whether the slides will be available following the webinar, and we will have a link to the slides with the recorded webinar. We'll make that available to all the attendees. So Dr. Roberts-Gray, I have another question here. It's a two-parter. So the first one is, do you know if the increased servings of fruits and vegetables in the intervention were fresh fruits and vegetables or processed, like squeezable pouches? And then I have a second question as well.
Okay. The data with which we are working is the coded food. And so we do have it. We did collect information about how the foods were packaged, but the analyses that we have done was based just on, based on their nutrients. Is it a vegetable? And we did not separate whole fruits from fruit juices for this particular analysis. So I can't answer the question about how they were presented. We do have some data on that, but we haven't analyzed that.
Great. So the second question is, were any of the ECE providers participating in CACFP, or were these ECE providers serving higher income households? And did you see a difference by income level?
And the answer is both. Yes, we did have some of the centers were participating in the child and adult care food program. Our sample of families was, as you suspect, higher income. So the answer was to both things. The answer is yes, but we didn't have enough facilities participating that had CACFP for us to compare. It would be comparing just one or two centers with all the rest. So we haven't done that analysis.
Good. So another question that's very interesting is, do you have any hypotheses about why parents pack so many sweets? One thought is that parents buy sweets for the kids because sweets are a symbol of childhood.
And I think that, again, this is back to, I think we need more research on this question. One of the things that has been observed is that parents pack what they like, and that they assume that the children like what they like. The other thing is that we tend to, that because children do have a genetic preference, I mean, our taste is built to approach sweet things and to avoid bitter things, that vegetables are not as, not to our tongue as palatable, and we may be just carried away with that sense as an adult, that what we want is sweetness, and that we assume that that's what our children want. So I think there are lots of different hypotheses about it. I think the most important takeaway, though, is that here we have a case with the packed lunches where parents are entirely in charge of what they're putting in those lunches. And if you think, well, the children are throwing a fit and that's why it's turning out to be that way, we also collected data and did analyze data on how much communication there is between parent and child about what to pack in the lunch, and it's very little. We got nice increase in it, but it still was very little communication between parent and child about what to pack in the lunch. So, and then I forget what the last part of that question was, a hypothesis. What was it, Deanna?
No, it was just asking if that was a symbol of childhood.
A symbol of childhood. And so it is the parents who are making the decision, I think. I don't think it's the children who are driving the decision. So it could be that the parents see it as a symbol of childhood. And I will say one other thing, in looking at the home inventories, that what foods the parents had in their home inventories, they had very little sweets in the home inventory, but lots of sweets going into the children's lunches. And so that bears out that last notion that well, the parents see it as a symbol of childhood and they're only buying it to put in the children's lunches. So if that turns out to be the case, we need to do something about that.
Yeah, it really could be part of societal norms or parent norms too. So I think further research, as you mentioned, would really be good in this regard.
Yes.
So another question is, were parents receptive to the results and willing to make changes to lunches packed?
Well, we did get significant changes in the lunches, and the parents in our debriefing groups did tell us that they were wanting new ideas about how to pack lunches. One lady said, I wish someone would just shower me with new ideas. And we did. In the newsletters, there are, sample lunches, sample meals. So the parents are interested in it. Another thing that parents said was, in the debriefing groups, was just have no idea about portion sizes. And that was a dad. And so I just keep putting stuff in to the sack. So they are sensitive to it, but we did not see the kinds of major changes that we would have liked to have seen in the vegetables, or even the prevalence of the vegetables. And if you look at the food, except for the possibility that they are substituting whole grains for refined grains, it looks like the response was just to add a little bit more vegetable, or a little, to just add it to the meal, rather than to change the way they're packing, just to throw in another carrot.
However, on whole grains, it was a substitution effect, correct?
Right, that's what it looked like.
Yeah. So following up on that portion size that you just mentioned, is someone actually talked about, ask a question about, did you study looking at portion size provided by parents as well as time allowed for a meal? And is the portion size age appropriate? Many parents serve too much.
And that's what we found, yes. That there are portion sizes of vegetables. That we did base it on the CACFP guidelines for what a portion is for the lunch meal. That was our criterion, and we did it age specific. So we were using portion sizes to evaluate servings, the number of servings that the children were provided, and the number of servings that the children consumed. And now I've lost my train of thought. Repeat the question to me.
Oh, about did you measure portion sizes, and then is it an age-appropriate size? Many parents serve too much.
And that's what we found. Yes, our primary outcome measure was number of servings, and so we did analyze that. What we did not measure was the amount of time spent in the lunches. We did not observe the total lunch time at the places.
Yes, and from doing some of the observations, I can tell you it varied. Sometimes you'd have a kid that would sit there and take their sandwich apart and eat it piece by piece. Very interesting. So Cindy, another question here is there data or studies for retraining the parents to eat healthier?
And I am not the one to answer that question. I was the evaluation specialist here on this and about the child interested in the developmental phenomenon of it. But so Deanna, you would know more about whether there is research on training parents to eat healthier.
There are other studies to do that. I think in this study, though, the focus was more on the child. And unfortunately, we never did measure the parents to ask about their eating habits, or we haven't followed up on that. So that would be interesting. Okay, another question. You mentioned sharing food. Was that observed and recorded in a different study?
And as far as I know, we did not do that. We do, let's see, we did look to see if what we observed in the lunch sack was not exactly what was available to the child. So notes were made about that, but we did not try to capture food sharing. That would be, and we did not. So yeah, I don't have any data on that. No.
Yeah. So another question is asking about some of the intervention parts, Cindy. So were the children exposed to outdoor activities, taste tests, or gardening as part of the intervention?
All of the activities there were circle time activities, there were lunchtime activities, there were snack time activities. There were activities like one of the pictures that we showed was of the grain train, of building a grain train around the classroom. So we did not have any gardening activities, as far as I know, in it. And it was designed for the interior of the Early Care and Education Center. So, but that's a good idea for the future to think about the outdoor activities.
Yes, and some of the schools, I mean, some of the centers might have had that. I don't know if we necessarily picked it up. We haven't really looked at much of that. So, but as Cindy said, good idea. So here's an interesting question. Did you compare the contents of the meals sent from home to meals served by centers? Sorry, let me start that again. Do Texas state regulations require meals brought from home to follow the CACFP meal pattern as they do in North Carolina?
So the answers are yes and no to that. Is that in Texas, if it's a center that requires the meals to be brought from home, they have to have the letters from the parents agreeing to that. So that if a parent consents to providing the meal from home, then the center is not required to meet the CACFP or even the Texas licensing requirements for meals. But it is in the guidelines and in the like the Texas Rising Star guidelines for higher quality centers, and it's in the national guidelines for health and safety standards for early care and education centers, that the meals, even if the parents have sent it, that the center has an obligation to see that the children's meals meet those standards. So, but it's, to my knowledge, and I asked Deanna to verify this for me, they are not required to do that in Texas, are they?
Correct. Yeah, you're right. They're not required. I will say, though, and one of the things in trying to get to a high quality ECE center, parents often sign those waivers, and I don't know if they necessarily read them all, to be honest, although we haven't done any research on it. So it would be interesting to know, did they realize that or not?
And we do have another paper that's being reviewed right now where we talk about the center level policies and procedures, and some interviews with the directors. And we had directors who told us that the food that children eat is a matter between parent and child and not a matter for the early care and education center. So, so that is another important area for future research.
Okay, so Cindy, another question, we'll answer a couple of more questions, is, did you do a pre and post test of parents' nutrition knowledge?
And yes, we did. And it was not a long test. It was questions mostly about portion sizes, knowledge of portion sizes for fruits and vegetables and whole grains, but some other like, what are good sources of I don't even remember them, but we did have a pre-post test on knowledge, and we did get really strong increases in knowledge. The parents were not highly knowledgeable at the baseline, but their knowledge improved after the intervention.
Great, thank you. So it's another question is, for future research, would you consider including existing nutrition education programs such as Cooking Matters as interventions for the parent and ECE staff? So Cooking Matters is a course series teaching about healthy eating, shopping tips, and raising healthy eaters to parents and ECE staff specifically.
And I think that's an important consideration, because again, not in these particular data that we're talking about today, but in our debriefings with the families and in our interviews with the debriefings with the teachers and in interviews with the child care directors, there was a consistent theme was that the teachers don't feel confident in their nutrition knowledge and don't feel confident in talking with parents about children's eating. So I would certainly think that that's another really good idea, is to have this intervention could very neatly be layered with some other stacking your nutrition credentials for the child care.
Yes, and I think actually being a little bit more proactive about the environment, there's several things that we could do as well. So that's a good observation. So Cindy, another question, what are your next steps?
So as soon as we get off the phone call here, I'm supposed to be working on a proposal that we are wanting to investigate how to improve the implementation of this intervention so that we can go more wide with it and reach more families. So that's definitely an immediate next step, is we think that it's important that this intervention is needed and appropriate and successful, and so we need to figure out how to get it into lots of hands and done well in lots of facilities. That's a next step. But then those other next steps that I really hope we will continue to pursue in our research is, why are the parents packing all those sweets and not so much vegetables. So, and why do we see in their home inventories that there's no sweets, but in those children's lunches, there are sweets? How is that?
So here's kind of a follow-up to that, Cindy, question that just came in. Were food costs driving parent lunch packing practices instead of dietary requirements?
And one of the things that we cover because we did this, we said at the outset, if we're trying to get them to do more vegetables and more fruits, and particularly whole fruits and whole vegetables, and everyone is saying that that's too expensive, let's do the study and see, so how much does it cost to put in the fruits and vegetables versus we've got shopping tips in the handouts, and also evidence that you can pack a lunch with whole fruits and whole vegetables for less money than if you're buying the sweets. So we did address that in the intervention. The particular population we had was higher income, and so I don't think affordability was as much of an issue for them. But even for lower income families, it's still, and I'll tell this story from, not from our study, but from talking with someone else on their research, is that the lower income parent telling them, I will buy more apples because the children never ask for, give me more apples, but I was buying cookies and they kept saying, give me more, give me more, give me more. So parents don't think about the fact that apples and carrots and things are foods that children will eat. They do like them, and they're not as expensive as all those cookies.
You know, I think another thing, kind of not necessarily related to cost, but related to convenience, is so oftentimes you'll see fruit packed in very convenient one-serving containers, whereas you won't see it a lot with vegetables. You might see carrots, but you don't have a lot of variety. So that's something too, is looking at the market side. How can we have healthier foods that are more convenient to parents that have to pack every day? Because it's a lot for them to put together these lunches every day. Okay, one last question, Cindy, and then I'll wrap it up. Do you have any strategies to suggest for parents packing healthier lunches?
My first thing would be that trust that your children are going to eat whatever you pack. And so start by packing the fruits and vegetables and whole grains. And then if you have to put in other things, go ahead.
Great.
Well, and let me expand that. All 5 of the My Plate groups. Because we also saw that the children were not getting as much dairy as they needed. So all 5 of the My Plate groups, and trust that your children are going to eat those, and if you put in the sweets, they're going to eat some of them. But if you put in lots of vegetables, they will eat more vegetables.
That availability and accessibility.
Yes.
So thank you all for being on the webinar today. We will have this posted on our website. We will have links to some of our research on the website too, so you can go and read the papers. Several people have asked about our materials. They are not available now, but we are working on that, and we can also update you as they become available. So thank you for your interest in our LunchBag study, and thank you, Cindy, for sharing the results with our audience. And y'all have a great rest of the afternoon. Bye now.
Thank you.